Imagine this, nearly 150,000 individuals, aged 90 and above, are forced to endure excruciatingly long waits in England's A&E departments each year. Some of these vulnerable seniors experience waits of several days, stuck in corridors, a truly distressing situation. The report paints a grim picture, detailing how older patients are left in their own waste, denied pain relief, and forced to witness the passing of fellow patients. Age UK reveals that over 1 million patients aged 60 and over faced waits exceeding 12 hours in 2024-25, with a staggering one-third of those aged 90 or older enduring this ordeal. Caroline Abrahams, the charity director of Age UK, calls it a crisis hiding in plain sight. She emphasizes that no one should spend their final days in a hospital corridor, yet this is the reality for some of the most vulnerable in our society. The report shares heart-wrenching stories: an older woman succumbing to a heart attack while waiting, an 86-year-old man lost in a disused corridor, and a man soiled in his own chair, unable to reach the toilet. One 79-year-old describes the scene as reminiscent of war films, with cues of stretchers and suffering. But here's where it gets even more disturbing: immobile patients are left in puddles of urine, and others are forced to use bedpans in public corridors. It's no wonder that many older patients, having experienced such trauma, are now reluctant to seek help in A&E, even in life-threatening situations. Abrahams highlights the heartbreak of these stories, noting that the older you are, the more likely you are to face lengthy and uncomfortable waits. She compares corridor care and long A&E waits to a rot eating away at the heart of the NHS, eroding public trust and the pride of dedicated hospital staff. Ministers are urged to take immediate action, with a specific plan and timeline to end these long waits and the practice of corridor care. The Liberal Democrat MP Helen Morgan joins the call, emphasizing that such harrowing stories have no place in a modern, decent society. Professor Nicola Ranger of the Royal College of Nursing calls the report devastating, describing long A&E waits as a moral stain on the NHS. Daniel Elkelees of NHS Providers and Rory Dayton of NHS Confederation both emphasize the need for urgent investment and viable alternatives to A&E. Health Minister Karin Smyth MP acknowledges the heartbreak of the report, promising an end to corridor care. The government's investment in urgent care centres, ambulances, and mental health facilities is a step towards this goal. This issue demands our attention and action. What are your thoughts on this crisis? How can we ensure that our elderly receive the dignified and timely care they deserve?